God bless you. So imagine this. You or your brother, your grandfather, friend, going in for surgery. It's a routine back surgery. You've suffered from back pain since you played sports in college. And you're going in, it's routine. You've had back surgery in the past, so no concerns, really. You've got a great surgeon. You go in, this surgery is successful, and you're going through recovery, and something odd starts to pop up. Little symptoms like your blood pressure is dropping oddly low, you're getting dizzy spells when you stand up, nausea, vomiting. They kind of, symptoms that can occur post-surgical. So the nurses and the doctors are treating them as they are. And they do take you in for a few tests, but days pass by. And then a very extreme symptom starts to pop up, and that's numbness in your legs. So immediately they take you in for an exploratory surgery, and they find that there's a large blood clot that has been pressing against your spinal cord. And the doctor comes in, and it's a life-altering talk that he has with you, basically saying, you're never going to walk again. At this point, you're 68 years old. You've worked since you were 15. You have never been anything but independent. And as I say, this news is life-altering. You're now a paraplegic. All the things that you used to take for granted are now things that you can't even do on your own. You're needing help to be clothed, fed, get from point A to point B. So at this point, this is when they come seek your assistance. Legally, they're looking for compensation for economic damages that have occurred in this situation. So that's what I'm going to speak on today. So they come seek your assistance, and being that it's a medical situation, that's where I come in. As a certified nurse life care planner, I can assist you in finding those costs for the economic damages. The nice thing about nurses being life care planners, as Barb mentioned, many people can go and get training and certifications and such, and a broad array of different professionals can do that. But what I like about nurses doing it, and of course I'm biased, but I like that we've always, as nurses, had a more broad perspective on how we look at patients. We're seeing them as not just a patient, but a spouse, a family member, a provider, as most of us do, especially you guys in your field, you're looking at that as well. But we're looking at it at a broad perspective, and we're also collaborating with a team. When we're nurses, we're working with physicians, therapists, pharmacists, radiologists, family members, and friends. We're looking at it with a more broad perspective. So we come into being a life care planner with that broad perspective, looking at everything from A to Z. And then you're also looking at what they're needing post-injury, post-hospitalization. As a nurse, you're looking at rehab and home health and so many different aspects of their life, how they're going to work, when they're going to work, what's going to happen for their family, and everything that's involved within their life. So when you're looking for a life care planner that is a nurse, you want to look at their experience, as Barb said as well. That's important. For me, I've had, and you can look very specifically to what the patient had occur in their life, or you can look at it as more experience as a whole. I've had 14 years experience as a nurse. I'm also bachelor. I got my bachelor's degree in Nevada for my nursing. I've been in medical, post-surgical obstetrics, in a variety of different settings, which I like in that it gives me a lot of experience and expertise to draw from when I'm looking at your clients and their injuries and such. Within the qualifications as well, as I say, I have a BSN I am an RN. I've been active in the field the whole time in the clinical setting. And I've also gone through training and been certified as a legal nurse consultant and life care planner, which is important as well. That's not obviously a necessity, but through my associations that I'm part of, it's important. You get that continuing education as you guys are doing now, so it's important to stay up to date and have that information so that I can give a much more effective and efficient life care plan. And within my business, I do provide all of those services, the consulting, nurse expert witness, and a subset of life care planning is cost evaluations, future medical costs, things of that nature within the life care plan. So specifically, life care planning when it comes to economic damages. What is a life care plan? It's quite an extensive document. It takes quite a bit of time, and I wouldn't have it any other way. I'm looking at so many different aspects of the client and their injury, their medical history. I'm looking at the actual event itself that occurred. So it's an extensive medical record review. I do go do a home visit. Not always. There's a couple different levels of how life care planners go about their plan. You have some of your clients who have chronic pain, and you can go ahead and go through the records and talk to the client over the phone, and you don't necessarily need to do a home visit. But obviously there's your more extensive injuries that would necessitate a home visit, so that you're looking at every aspect of that client's life, and you can put that into your plan as well, so every piece of that is touched on. I do a full nursing assessment and interview. I do place nursing diagnoses within my plans that pertain to the client, and I can speak more on that as well. And then quite a bit of extensive research as to the costs. So economic damages, what kind of costs are we looking at for this client, for what's occurred already, and then for what's occurred in the, or what will occur in the future for them. And then I'm consistently communicating with you, the client themselves, and then I do request a healthcare release so that I can talk to the physicians that are caring for this client as well. Because of course that bolsters, within deposition or trial, that's going to bolster my plan for you guys for this client. Being that I've been in communication, the doctor's saying this, and it looks like they'll need this in 10 years, and so that's very important as well. The life care plan is very important in documenting the damages in cases where it's a catastrophic injury. And catastrophic injuries, as you see, are listed, but the main ones that I see quite a bit are the cerebral palsy, the spinal cord injury, as I spoke of in the story in the beginning. You're looking at brain damaged babies. I do have an OB history. Clinically, I've worked in a lot of different OB settings, and that's one of the big ones that I do life care plans for. Severe traumatic brain injuries as well, severe burns, and then amputations as well. That's something actually that I've had on a personal level. We have a family member who has diabetes and went in a span of 2 months, went into the doctor over 20 times. They kept saying, yeah, he's got gout, he's fine, he's got gout. Well, if they had just done an ultrasound of his leg, they would have found that he had no blood flow to his left foot, and he ended up having an amputation of that left leg below the knee. And this is a man who's been completely active, very independent. With prosthesis and PT and rehab, he'll get back. But he's one that on a personal level, he needs a life care plan because he was still working, he was still part of life, and it's just completely altered his lifestyle and how he goes about life. So some learning objectives for us that I'll touch on as well that are specific to this presentation: obtaining economic damage costs, proving them, and then I can show you guys some samples. And I just wanted to touch on defense reaction to damages. Obviously, I can do work for plaintiff and defense when it comes to life care planning, but I'll touch on some reactions there and how how I'm affected and how it'll affect you and your clients as well. So some of your main economic damages are going to be current and future medical hospital expenses. You're looking at medications, medical equipment, aids for daily living, rehabilitation, physical therapy, home health. There's quite a bit, but these are some of your main economic damages. So how a life care planner would go about obtaining economic damages. Of course, using past medical bills are the cat's meow when it comes to what we do, because you have it right there, it's right in front of you. They had this surgery, say it's a knee replacement, they're going to need it again in 10 to 15 years based on what the orthopedic surgeon is telling us. This is how much it was. These are all the hospital expenses, the care, the rehab after, PT, what they're looking at for all their different aids, if they need reachers or shoe horns to help with their getting on of their shoes, things of that nature. So using past medical bills and records to go off of is extremely helpful. And then also a big piece of what I do is I contact the local medical facilities. Of course, having all the codes for everything is key as well, because they'll say, oh, we don't know. We don't have that. We don't have a specific. What's the patient? What are they doing? But if I have a code and I can say, hey, it's this code for this surgery, what kind of cost are we looking at? And then the other thing is getting them to send that documentation, and I'll talk about that when I talk about proving economic damages. But that's probably the most difficult because, of course I reference all of that, but they'll say, oh, well, we don't know, or we don't have that information. So getting as many contacts as I can and getting that all documented is extremely important for the life care plan and putting together the tables for the economic damages. And then, of course, your local non-medical, and I didn't say this with the medical facilities, I'm calling in the area that your client is, of course, so that I can get specifics for that geographical area. So also with the non-medical, things like, this person can't take care of their home because of their injury or the catastrophic injury they've been through, restricts them from doing things like that. So what would it take to have somebody come in and help them with their home or their yard work, or they had to have a modified van put together for them? What kind of maintenance are they going to need on that? Or, there's so many different moving parts and things that go along with it, as you guys know. So calling all of those facilities as well and getting numbers. I also utilize different websites, fairhealth.org, and then healthcarebluebook.com is another resource. Those are just nice because they give more of a general, but they also go into the geographical area as well, which is good. Medicare websites, if it pertains to Medicare, and then different medical supply and aid websites. For somebody like the gentleman in the story, he needed quite a few different supplies and aids to get through his day. Simple things like a reacher, because he wasn't able within his wheelchair to get up into the cabinets, getting him a reacher. Supplies for his medical needs as well were really important, and getting them delivered to his home so that he had them. And all of those aspects play into it as well. When I'm getting these costs, I'm looking at 2 to 3 different sources, and then I'm averaging those. Because of course I don't want to give the highest, and of course I don't want to give the lowest. So a good average is important to place in the life care plan. So proving these damages, when I'm proving these damages, it plays into how I obtain them. I'm getting supporting documentation as much as possible so that in deposition or trial or to back up my life care plan, I can, say, hey, this is what the medical record said for this surgery that this client already had. It's right here in writing. So that's extremely helpful as well. So that would mean the bills, the medical records, and or similar surgery procedure invoices are good to bring along as well for documentation. Cost projections from the hospitals or all the different facilities that I contact, I always reference their names and who they are, if they're in billing. This is Irene, she gave me these numbers, and this is the printout that she gave me as well, as to what the cost of this back surgery would be. And then also for those non-medicals, I get quotes or invoices. So John needs this modified van to get around. It's going to need the maintenance. It's going to need tires and oil and all of that. He wouldn't have had to have this van if he didn't have this injury. So this is what the cost projections would be for him for that as well. And then the printouts from the medical supplies and aid websites that I go to. And I already had spoke on making sure that I reference it. If I don't get the documentation, I can, there's many a times where, well, we don't have anything to send, or that, I'm not able to get full documentation as to those numbers or those quotes. So when I go into writing the life care plan, this is just a little piece. As a consultant, we got some really great training on reviewing the records. Medical records for a nurse is like a book that we love to read. It's just fascinating to go through and read all that. I know for you guys, it's like, ugh, really? I don't want to read all that, piles and it would be the same for me with the different legal documentation. I don't understand as much or know what's going on. So for us, though, it's just fascinating to read through all that and get the information. And as Barb said, it's extremely important to have somebody who can be a writer. I wanted to do English in my college career and was prompted by my English teachers to do so because I really enjoyed writing. And so for me to sit down, and my family will say they get kind of sick of it, I'll sit there for hours and hours and hours and read and write. And so within the reports, it's very important that you can get somebody who can write well and that can really speak to what is important for that client. So this is just a snippet of that same story, this person who had underwent the surgery, the dates, the pertinent information for this person. And I do include a medical chronology within the life care plan because I think that's important for you and everybody involved to be able to know, okay, this is the important information that occurred for this client, when and where and why and the dates, so that you guys aren't fumbling through the records as well trying to figure out what went on and when. So this will be part, and there's also a full narrative of my assessment, my home visit, the doctors that they're currently seeing, the medications they're on. That narrative really sets everything up for you guys for the economic damages tables. So another very important piece of what I place in the life care plan is the life expectancy, and this is from the CDC websites. They specify ethnicity and then male or female, and then it goes through the life expectancy of the client. And this is where I get the majority of my numbers, because working with numbers, as our next speaker will talk about, is extremely important as well, as you guys know. So this is how I go ahead and get my numbers for each individual client as to the length of time for those costs that we'll be looking at. So as an example, here's one for physician care. As you can see, I place the service physician, say primary care provider, the beginning age and ending, which I get, as I had just said, from the life expectancy. And then I'm going to let you guys know the frequency, the purpose, and then it goes into the costs per visit, per year, and then the life expectancy of that person. And then also, as I say, I resource it at the bottom. And then I always have the supporting documentation that I was able to obtain for it as well. Medication, same thing. It just goes across. The half of my life care plan is going to be your cost tables for the economic damages. Home health diagnostics, physical therapy, mobility. Like for this gentleman, he needed a manual wheelchair, a power wheelchair. And then you're not just looking at the cost of those, you're looking at how often it's needing to be replaced, or the maintenance of it, or batteries for the power wheelchair, how often he uses. Did he use the power wheelchair in the home or just outside for visits, doctor's appointments, things of that nature? Is he using mostly the manual wheelchair? These are things that I can take the time to work through and figure out for you guys and for the client. And then medical supplies. This gentleman was diabetic and he needed catheterization. He needed home health for assistance with different care each and every day in the mornings and then in the evenings. So all of those are within the life care plan tables. And then, as I said, I was going to touch on the defense reaction to costs. And here I put it as the 3 Ds: discredit, devalue, and decrease. And as I said, I work for both sides, but just knowing that that's what's going to occur. I've been in depositions, and well, you're just a nurse. What do you know? Did the doctor back you up on that one? Can you better state what's going to occur for this client over a doctor? Like, who are you? So that's an integral part, and I know that they're doing their job and they're trying to figure out how to break down everything for their client on the defense end, and then decreasing those numbers. And as I say, I'm very objective and very fair with the numbers. I will take 3 from the 3 different sources and calculate the average of that, and I think that's very important because it shows I'm not just here to boost the plaintiff's side of this case. I'm here to give objective numbers. And yes, I got breamed by an attorney the other day. He said, well, how do you know that this person's going to need a cane after they have knee surgery? It's like, well, how would you know they wouldn't? I mean, you're giving everything that could be out there for a need of this client. If your client doesn't want to pay for a cane for them to get around, well, then they're probably going to fall again because they're not stable and their gait's imbalanced, and then you're going to have to pay more for the next surgery. So, it's something that just being aware of for me, and then, I'm sure you guys are aware of that too as well, but having that solid foundation in what I do as a nurse and a life care planner. No, I'm not a doctor, but I am a nurse, and I have all this experience and training and certification, awareness of what's happening for this client from A to Z. And if I don't know it, I'll research it. And I'll talk to physicians, and I'll talk to therapists, and I'll figure it out. So just being very objective and fair in that regard. And as to that case, we went to deposition, and it was a very positive experience. I was able to utilize all the things that I've spoken to you about, obtaining all those costs, proving those costs with documentation and referencing, and then having that concise and effective life care plan for that attorney was very effective as well. And of course, the whole team for this client really helped to create a favorable outcome, and the case was settled. And then in closing, a couple things that I always think of and that are important for you guys to be aware of when it comes to testimony for your life care planners is just making sure that, I know you guys are so busy and you've got so much on your plate, but just making sure that your life care planner is up to date with information. And of course you're not always going to have that information even from your client. Oh, well, something happened and I ended up not having my medication for 2 weeks and these are my symptoms now, or oh no, I haven't been taking that medication for months now, or things like that. There's a lot of different occurrences that happen that it's just very important for that life care planner to come in and know exactly what's going on, to have that contact with the client, to be able to do a quick update to say, hey, these are the things we talked about. These are the important things that we needed to talk about. What's going on with them? Are we all the same, status quo? Are we looking at anything new? So that's extremely important. And then also making sure that the client's depo, if that's already been taken, or any medical professionals' depositions, that the life care planner has a chance to look those over as well, so that they're not coming in blind to their own deposition and somebody's going, well, didn't you read that deposition? And this is what Dr. So-and-so said, and you didn't know that? So just having that up-to-date information as well in regards to the different depositions and the case for you, that consistent communication is huge. I know a lot of the attorneys that I work with, we exchange cell phone numbers, so it's easy to send a quick message to them or get in contact pretty easily and say, hey, this just popped up. What do you think about it? Can you call the client? Can you let me know what we should do with this? So having that good communication is very important as well. So I'd just like to thank you guys for letting me come out and talk with you in regards to economic damages, and I hope you have a great rest of your day.